Hello, Mrs. Daniels. Hi. It's Dr. Thayil. Pleased to meet you.
Hello.
Hi. I've been asked to speak to you and to examine your hands because you've got some pains.
Yes.
Do you want to tell me about them?
I've been getting quite a bit of pain down the fingertips,
Right.
in the middle of both hands. It shoots down. It feels like nerves, and it comes and goes very much.
Right.
I'm also getting a lot of pain across that part of the palm and around the knuckles there.
Okay.
Especially at night, if I wake up in the morning, I can't move my hand. It's that bad for a while.
Right.
And then it gradually wears off.
So, how long have you had these pains for?
About the ones down my fingertips, maybe 6 months or so, come and
Right.
go. And this one here is newer. It's just in the last few weeks.
Okay. And what makes them worse? Is there anything which makes it worse?
I think the one across here is made worse, I think, during the night. If my hand's outside the duvet and it gets cold, it seems to make it worse.
Hand gets cold as well?
Yeah.
Okay.
As far as the pains down the fingers, no, I can't find any particular reason for it, anything
Well,
that makes it worse.
how are they first thing in the morning?
I don't get the shooting pains down it first thing. I get a lot of stiffness in my hands.
Do you? Okay. And where is the stiffness? Which joints?
Particularly that joint.
Okay.
But it's travelling into all of them now. Too much typing as a youngster.
Are you a typist?
Yes, I started typing as I was 13,
Right.
on the very old machines that you had to bang,
I see.
and that seems to have damaged the...
So you're just coming back to your stiffness, you mentioned they are stiff in the morning. How long does it last for?
It never completely goes away. I feel it even now, at this time of day, and I've been typing, I've been using them.
How long does it
still...
really, how long is it severe for in the
It's
morning?
severe for maybe 5 minutes,
Okay.
no more than that.
And then it eases off
and
a
then
little
it
bit.
eases, yes.
Okay. And what other joints are involved, or is just the hands? Do you have any other joints?
No, there's one on the big toe. My hip joint has been sore on a few occasions.
Okay.
And I get a bit in my neck as well.
Okay. How about your elbows and shoulders?
Shoulders, I get it. Elbows are fine.
Elbows are okay. Do you have any pins and needles or numbness in your hands? You mentioned there.
No, not
No.
apart from those when they have those shooting pains,
Okay.
which they do feel a little numb.
Okay.
But apart from that, no.
You don't have any other numbness now?
No.
Do your fingers change color in cold?
Not really,
No.
not noticeably.
Okay. Any other symptoms? Any problems with your eyes or
No.
bowels are okay?
Fine.
Yeah. Any rash anywhere?
No rash.
No rash. Okay. Are you otherwise fit and well, or do you have any medical problems?
I'm quite fit. Yes.
Fit and well, yeah.
For my age, I'm quite good.
Good, that's good. Are you on any regular medicines at all
I'm on meloxicam.
for the pains in the
For,
joints? Yeah. And how does it keep on top of the pain, or is it still insufficient?
It used to be better than it is now, I think, perhaps.
Okay.
I'm swithering as to whether to ask to have it increased. I'm only on one.
Okay,
at the
one a day,
moment.
yeah.
But
Do you
I've
smoke?
been trying not to increase it. No, I don't smoke.
You don't smoke, okay. Any family history of arthritis?
My grandmother had it in her later years, but nothing early.
No one had rheumatoid arthritis or psoriatic
No.
arthritis, inflammatory bowel disease? No.
No.
No. Okay. Fine, let's have a look at these hands. I'm going to get this pillow. Tell me if it's sore in any one particular area so I can avoid touching it.
Right.
Are these sore?
They're not hugely sore at the
No.
moment now. It comes and goes.
It's there in most of your
Yeah.
fingers, isn't it? At the
Yes.
very
Sometimes they swell up, especially the middle fingers. There's that joint swells and
swells
gets
up, yeah.
quite red and angry, and It's
Okay,
very
do
sore.
like that for me. It seems to be okay. Okay. And turn them around for me. Okay, can you do like that for me? Just checking it. No, just in front. Yeah. Okay. Right. I'm going to check the movements of your hands.
Okay, you have 2 minutes remaining.
Look up. Yeah. And down. That's quite good. Yeah. Can you squeeze my fingers? That's quite good grip. And there. Okay. And you don't have any problems doing things at home, or it's not preventing you from doing
I
things?
find my grip is a lot less than it used to be.
Okay.
I mean, I did martial arts for years. I had very good
Yes,
grip,
yes.
and I feel it is less, but I'm still doing quite a lot, and I'm
Yeah.
sure
It's not preventing you from doing anything.
it's not
that
preventing
you
me
used
from
to do.
doing anything now.
Okay. Okay. Now, from what you've told me, and after looking at your hands, it looks like you have what we call osteoarthritis, which is the wear and tear arthritis. Now, there are two broad categories of arthritis, wherein there's wear and tear changes without much inflammation, and the second time which there is inflammation in the joints, and which causes a lot of pain, stiffness and swelling, and can cause long-term damage. So fortunately, you've got the first variety where there is not a lot of inflammation, but there is some wear and tear in the joints. We don't have any specific treatment for this, but if there is any particular swelling, particular joint which is very bad, we can inject it with steroid. Otherwise, we usually just give simple painkillers, paracetamol. Meloxicam is useful. We can try others once. Sometimes gel also helps. If you have, let's say, if this particular finger is very sore, you can try applying diclofenac or ibuprofen gel, which helps. We can give you some information leaflets. It will have information about exercise. We can refer you to physiotherapy. Sometimes they can give you exercise in the hands, which might be helpful. But unfortunately, we don't have any specific treatment for this one.
Is glucosamine of any?
Some people use it and some find it helpful, but there's not been a very firm evidence to say it really helps. But there is no harm in trying if you want to try and see if that makes a difference.
Okay.
Okay?
Right, thank you very
Thank
much.
you so much.
Please give us your diagnosis and findings for this patient.
My diagnosis for this patient is nodal osteoarthritis. She has got Heberdens nodules in symmetrical involvement of the distal interphalangeal joints with very little inflammation. There is no involvement of base of both the thumbs. Her hand functions are quite well preserved.
What's the differential diagnosis of distal interphalangeal joint arthritis?
The differential diagnosis is nodal osteoarthritis, psoriatic arthritis, crystal arthropathies like gout, pseudogout, and occasionally septic arthritis can involve the distal interphalangeal joint.
How would you manage this patient?
The management would be symptom based. For pain, I'll give simple analgesics like paracetamol. Higher up, we could give non-steroidal drugs. For particular joint involvement, local treatment like ibuprofen or diclofenac gel might be useful. I would refer her to physiotherapy for exercise of her hands and give her education leaflets for about that. Swelling of the hand joints is a common station in patients. Occasionally you may come across a patient with osteoarthritis, and it's important to palpate the swelling and make sure it's not synovitic but it's bony, which will be the case in osteoarthritis. And you should always also examine the base of both the thumbs. That's also a common place which is affected in osteoarthritis. And as with any other hand involvement, you should look for any rash, any psoriatic rash, and also examine the function of the hand by checking movements at the wrist, MCP joints, and asking the patient to perform certain maneuvers.